good morning to all. I am Prof.Manavalam working in SNS College of Nursing. Today we are going to see an interesting topic in midwifery and obstetrical nursing, that is prostaglandins. So before entering into the topic, we can see the case study. Through this case study, we can know about what kind of drugs we are commonly using for induction of labor at the time of term. Let us see about the case study. A 41-year-old primigravida mother. The mother is primigravida at 41 weeks of gestation, but the cervix is unfavorable. Her Bishop score is 4 and is present for induction of labor because of postterm, because it is more than 41 weeks of gestation. But her medical history is unremarkable and she has had an uncomplicated pregnancy. The fetal heart rate also, it is reassuring. So they plan to deliver by inducing the labor. So for induction of labor, commonly they are using the two varieties of drugs. The first choice of drug is prostaglandins. There are varieties of prostaglandins available. Let us see what kind of prostaglandin commonly they are using for induction of labor at the time of the term. First, we will see the general introduction about the prostaglandin. Prostaglandin is nothing but it is a group of lipid components. It's mainly derived from the fatty acids. It is commonly involving or doing many physiological processes. It is including the inflammation, pain relieving, fever, it is subsiding the fever, and it is helpful. It is very much helpful for the reproduction process. But in obstetrics, a prostaglandin is playing a vital and a key role while induction of labor or during the time of labor. It is mainly caused for cervical ripening and uterine contraction. At the same time, it is mainly essential for the controlling of bleeding after delivery of the placenta. That is postpartum hemostasis purpose also. It will commonly playing major role. It has the ability to stimulate the uterine activity that makes the valuable tools in managing various obstetrical condition without any complication. Let us see about the indication. It is more commonly using in case of postpartum pregnancy for induction of labor. Sometimes any fetal demise that is happening in intrauterine itself means in order to deliver the baby in yeast they are using this. When the mother is having any medical condition, take as example of diabetes mellitus, hypertension means, but it is mild in symptoms. Hypothyroidism or hypothyroidism means in that condition we can use this we can use the prostaglandin for induction of labor to ease the delivery process. And those who are recurring delivery, and it mainly helpful to fasten the process of delivery. For this purpose, we are using the prostaglandins for induction of labor instead of waiting for spontaneous in case of postpartum pregnancy. There are different types of prostaglandin which is available in the market. And these common types are PGE1. It is classified into PGE1, PGE2 and PGF2 alpha. PGE1, the misoprostol is coming under the PGE1. It is one form of synthetic form of prostaglandin. It is mainly used for labor induction. At the same time, it is mainly used for postpartum hemorrhage management. Next, move on to the dinoprostol. It is one of the naturally occurring prostaglandin. It is otherwise called as a PGE2. It is commonly used during the time of induction of labor. It is the common drug used for induction of labor. It is mainly helpful for the cervical ripening and labor induction. And the last one is PGF2 alpha. That is otherwise called as a carboprost. It is also one form of synthetic form of prostaglandin. It is also mainly used for the postpartum hemorrhage management. Next, we will see about the mechanism of action of prostaglandins. During the time of induction of labor, it has the three main mechanism of action. The first one is it is mainly helpful for the cervical ripening. It is prostaglandin. It acts as on the cervix. It is soften and dilate the cervix. It is the process of laboring. Second one is it is also along with the oxytocin. It is inducing the uterine contraction, but it stimulates the rhythmic uterine contraction that is essential for the labor progress. And after the delivery of the fetus as well as placenta, it is mainly helpful for the postpartum hemostasis. It It is reducing the postpartum bleeding. So this is the mechanism action of prostaglandin. Next, move on to the commonly used prostaglandin for the induction of labor, that is called as a dinoprostol. It is in trade name is Cervidil. The class of, it is coming under the class of prostaglandin E2. The mechanism of action is it is stimulating the collagenous substance that is present in the cervix. Through that, it is stimulating the cervical ripening, and also it is increases the intracellular calcium release within the uterine smooth muscle cells. So automatically this calcium, it will be very much helpful for the muscular contraction. So it is contracting the, it is helpful for the uterine muscle contraction. So the cervical ripening and the uterine contraction, both the process, it's going on simultaneously in order to progress the labor. Main indication for cervical ripening to prepare the labor process. In case of spontaneous abortion, they are using the dinoprostol gel. For induction of abortion and the induction of labor, they are using the dinoprostol gel. Route of administration, either endocervical or intravaginally, they are applying this, or they are administering the dinoprostol gel. Side effects, mainly it is cause for uterine hyperstimulation, abnormal fetal heart, nausea, vomiting, diarrhea, diaphoresis, cardiac arrhythmias, amniotic fluid embolism. So the contraindication and the caution, whatever things we have to do while we are precaution we have to follow while we are administering the dinoprostol gel means, if the mother previously underwent any cesarean section or any kind of uterine surgery, we should not administer dinoprostol gel. In case of grand multiparity, more than 4 or 5 delivery the mother underwent means the muscle that doesn't have that much power, we should not administer, it cause for uterine rupture. Next is cephalopelvic disproportion, unfavorable fetal position, we should not administer because the normal vaginal delivery, it is not possible in case of abnormal fetal position. Placenta previa, there is higher chance of bleeding. Pelvic infection, we should not administer because we have to administer vaginally, it causes for further infection. Active genital herpes, asthma, glaucoma, hepatic, renal, respiratory and cardiovascular disease, we should not administer because it stimulates the uterine muscle contraction, and as well at the same time it is releasing the calcium channel, it causes of muscular contraction overall the body, it leads to further damage to the cardiac, respiratory, renal and hepatic muscles. Next, move on to the prostaglandin E1 F2. So prostaglandin F2, it is mainly used in case of uterine atony. It is happening in case of it is one of the reason for postpartum hemorrhage. So to manage the postpartum hemorrhage, we are using the carboprost. Carboprost used in the name of carboprost romethamine. It is mainly administered as an intramuscular injection. The dosage is 250 micrograms. May be repeated the dosage every 15 to 10 minutes. Up to maximum 8 doses we can give. Advantages, mainly it is helpful for controlling the postpartum hemorrhage that cause for uterine atony. But the disadvantage or side effects of carboprost are nausea, vomiting, diarrhea, fever and bronchospasm. Next, move on to the misoprostol. It is otherwise called as a PGE1. Main indication, we are using the misoprostol for medical abortion during the first and the second trimester. And also we can manage the missed abortion or incomplete abortion in order to expel the product of conception that is remain inside the uterine cavity. The agent used is misoprostol. Otherwise it is combined with mifeprostol they are using. Route of administration, either it may be used as a oral, vaginal or sublingual method of administration. So dosage, it may be vary depending upon the gestational age. But they are starting with 200 micrograms and it end up with 800 micrograms. Advantages are and side effects are, it leads to cramping, bleeding, nausea, vomiting, diarrhea, risk for incomplete abortion that needs requiring surgical intervention for further. Main advantages are, without going for any surgical method of abortion, if the mother meeting the criteria of medical termination of pregnancy, without undergoing any kind of surgical management. They can medically undergo the abortion process with ease in the home itself. They can have this medication under the guidance of doctor, and they can have the abortion. For this is the major advantage of using the misoprostol. Next, move on to the side effects. Already we have seen the side effect individually, but overall side effect of prostaglandins are bronchospasm. That's why we should not administer in case of asthmatic patient. Uterine rupture, we should not administer in case of the patient those who underwent previous any uterine surgery or cesarean section. There is more prone of uterine rupture. Fetal heart rate abnormalities. If the fetus is a non-reassuring fetal status is there, means we should not induce the labor by administering the prostaglandin, because it further leads for fetal distress. Uterine tachysystole, so it causes for uterine hyperstimulation. So in case of already the mother is having more contraction, means we should not administer the prostaglandin. And it causes for nausea, vomiting, diarrhea, fever and chills. We have to have the medication for to manage. These are all the side effects. Next, the nurses are playing a major role while administering the prostaglandins. So how we can manage the patient, those who are having the side effects? So what are the things we have to manage while administering the prostaglandin? Continuous fetal heart rate monitoring is very much essential in order to know about the early fetal distress and manage in order to avoid undue complication to the fetus. Next, uterine contraction we have to monitor the frequently. In that we have to check it about the frequency of uterine contraction, duration of each contraction and the intensity of the uterine contraction we have to monitor. We have to assess the bleeding, any excessive bleeding that is present through vaginally or not, that we have to monitor. Monitoring of the maternal vital signs is very much important, because in case of any changes that will be occurring in the respiratory, hepatic and renal function as well as cardiac function, means we can know it by monitoring the vital signs, especially blood pressure, pulse, temperature and respiratory rate we have to monitor. And at the same time we have to monitor the adverse reaction that is happening because of administration of prostaglandin. Mainly the mother may experience nausea, vomiting, diarrhea. We have to manage them with adequate fluid administration, and anti-emetic administration is very much essential to manage this complication. So better we have to put the mother under cardiotocography. So it mainly monitoring the uterine contraction, fetal heart rate. Same time we have to have the photograph in our hand to monitor the maternal vital signs and the side effects, and also the IV fluids intake output also we can monitor by using the photograph. So as a summarization of the prostaglandin, it is a valuable tool used in obstetrics. It is playing a crucial role in labor induction and postpartum management as well as the termination of pregnancy. So we have to understand the mechanism of action, and carefully we have to administer. We have to always monitor the mother as well as fetus in order to avoid any undue complication to both of them. So I think everyone understand very well about the prostaglandin. Thank you all.